Hi, everyone. This is Josh Halpern. I am a reproductive urologist at Posterity Health and an adjunct assistant professor at Northwestern University in the Department of Urology. I'm excited to give you a very brief summary of some work that we presented recently at the ASRM on vasectomy pricing. And this was a collaborative effort between our group at Northwestern, the Case Western group, and the Cornell group, where we looked at variability in hospital pricing for vasectomy. By mandate, hospitals have to report their pricing for specific procedures. And so we use something called the Turquoise database, which kind of puts those self-reported pricing data points together to try to understand what percentage of hospitals were offering self-pay pricing for vasectomy and what that self-pay pricing looked like. Even though a lot of men will have insurance coverage for vasectomy, for a fair number of men, vasectomy may not be covered by insurance. And given the fact that we do over 500,000 vasectomies annually in this country, it really is an important form of contraception for a lot of couples. And so what we found by looking at pricing when it comes to vasectomy is that there's huge variability in self-pay pricing that hospitals publish for a vasectomy. So the 10th percentile of vasectomy pricing, when we look at self-pay prices for certain hospitals, gets to be as low as in the $300 range, whereas the 90th percentile gets to be as high as the $7,000 range. There's about a 19-fold difference between those two, which is pretty staggering. There are certain variables that seem to predict who's going to have a higher price. So, high population urban centers, pricing tends to be a little bit higher at those hospitals. Academic hospitals, pricing tends to be a little higher. But the main point here is that there's just tremendous variability in pricing when we think about the self-pay prices for a vasectomy at these various hospitals and institutions. So I think the take home here is, number one, there's a lot of variability, and that cost on the high end really might be a barrier for couples accessing contraceptive care. The other thing that's really important is for patients to understand that these data are publicly available and they can make a really informed decision by trying to find this information and making sure that they're going to an institution that not only provides great care, but provides care at a reasonable price.